one of the measurable, concrete, least desirable outcomes that everybody at Children's National cares about are patients who decide to come because they have an emergency need and they ultimately leave without being seen by a provider. That phenomenon is common enough that we can model it. I had some skills to actually put hands on keyboard and use this perfect target for prediction, measurable concrete outcome of left without being seen, to see if I could create a prediction model that would help us identify the times when it's going to be most bad and maybe do something about it. And I had all this cooking when the Virginia Tech and Children's National Collaborative started to come together.
Kenny had a very interesting problem, a very meaningful problem. I just love working with data. I love problem solving. Kenny had already done a first pass, a really good first pass at a model for predicting left without being seen patients.
On one day a week, if we identify a period that's going to have 2 or more high acuity patients leaving without being seen,
then we implement a surge team which provides extra resources to the doctors and the ER.
Either myself or one of my colleagues comes in and works in this extra overflow space, and the doctor and nurse together work as hard as they can to pull as many patients from the waiting room as quickly as possible to prevent any high acuity patients leaving. This model is still a research model, and the accuracy is pretty good, but it can be better. And there are different algorithms that Patrick Butler's been working on at Virginia Tech that are very promising. The expertise, the skill, and the partnership that we get out of Virginia Tech is the opportunity to make that next step.
I think one of the most rewarding things of this is that it's a very tangible outcome. And so much in academia is you solve a problem, you write a research paper, and then sometimes that you get to put that into practice. Sometimes other people put that into practice. But I think with this, we're very close to the outcome. You know, I have kids, and you know, it's important to find the best health outcomes for them.